As a caregiver, one of your main responsibilities will be in bathing the patient. Bathing is an important responsibility of yours for a number of reasons. One is that it helps prevent infections by keeping the body clean. Secondly, it gives a sense of well-being and helps refresh the patient when you're bathing them. Thirdly, it also gives an opportunity for you to inspect the skin on a very regular basis. Hi, I'm Kathy Getrust, and I'm an instructor in community health. This tape specifically is going to be talking about giving a complete bed bath. A complete bed bath, as the name implies, means that you will be washing the patient's entire body. Usually patients who need this kind of bath are ones that are very weak or very ill and will not be assisting with the bath itself. You will be doing most of the bathing of this complete bed bath on your own. Another tape will be discussing other types of baths that you will be giving, baths such as tub baths, showers, and partial baths. So please watch now as a demonstration of a complete bed bath is given. Prior to starting a bed bath on a patient, it's important that the caregiver wash their hands thoroughly before coming to the bedside. Once the hands have been washed, it's important that the patient is told what is going to be happening, an explanation is given to them, and that privacy is provided. Privacy can be provided by pulling the curtain all the way around the patient. Because of the demonstration that we're doing today, that won't be possible, but in reality, you would want to be certain that it was total privacy prior to starting the bath. Then you will want to obtain all of the items necessary for giving the bath and place them on the overbed table. The items that you will want to have would be the basin for the water, the soap, some washcloths, usually 2 or 3 would be good, bath towels, several again would be important to have. You're going to want some lotion that you can use on the dry skin at a later point, nail clipper, and orange stick for cleaning the fingernails and toenails. Then a bath blanket for warmth, as well as a clean gown. The other item that you'll want to have is a laundry hamper or a linen container for the soiled linen after it's removed from the bed. It's important to have the bed at a comfortable working height for you, the caregiver. Once that has been achieved for good body mechanics, then the side rail can be lowered, but lowered only on the side of which you are working. Then you'll want to be taking the top bedspread off, loosening it at the foot, folding it inside itself, making certain that you're not airing these soiled linens, holding it away from your body, and then it can be placed into the laundry hamper. Once that's been done, then the bath blanket can be placed on top of your patient. This is going to help provide privacy, and it also is important for warmth. Many times, even though the room might be comfortably warm for you, it is cool once the patient has water on them and their skin becomes damp. Once the bath blanket has been applied, then the top sheet can be removed underneath the bath blanket. Sometimes patients are able to hold on to the bath blanket to assist in this. In our instance, the mannequin's not able to do that, so we're doing it completely by ourselves. Once the bath blanket has been applied, Then the side rail can go up, and it is not until this point that we obtain the water, and that's because we want to make certain that it's as warm as possible when the bath is started. So now the caregiver will go and get their water. The caregiver is back with the water in the basin, and the water should be approximately 105 degrees. Now the side rail can be lowered, and the patient's gown is removed. The patient's gown is loosened in the back. Sometimes they have straps, sometimes they'll have snaps. But you notice that the caregiver is being very careful to remove the gown, but yet not removing the bath blanket so that there's a loss of privacy and warmth. So working underneath the bath blanket, the gown is removed, and since it's soiled, it will be placed in the laundry hamper since a new one will be applied. Now that that's been done, I want to talk a minute about washing with the washcloth for a bath. It works best if a mitt is made, and a mitt is a way to prevent water from dripping on the patient and on the patient's linen, and it also is a way of controlling the washcloth. The caregiver has done it once, and I'd like her to slow it down now and show it in a little bit exaggerated slow motion. You notice that she's wrung it out of excessive water, and then she takes the washcloth and wraps it entirely around her hand, and then takes the other end, tucks it in at the palm level, and you notice there is not a lot of excessive water, and she has control of it, and it stays on her hand. Now that that has been placed on her hand, she will take her other hand and pick up her towel and put it across the patient's chest so it's available when she wants to dry the face. Always start with the face, and the portion of the face that gets washed first always are the eyes. And you would use a separate portion of the washcloth, and starting from the inside, called the inner canthus, and working outward on the eyes are cleaned and make certain that any incrustation is removed, and then the rest of the face can be washed. Most people do not have soap used on the face, certainly not on the eyes. Sometimes they will ask, and you could ask the person if they would like to have soap used on the rest of their face, but remember never to use soap on the eyes. Then the rest of the face, the neck, and the ears get washed. Be certain that you don't get any the washcloth too far into the ears, and then rinse and dry your face, neck, and ears. Now it's time to wash the upper extremities. It's important to start with the distal or the far arm first. And the reason for that is you want to be washing from clean to dirty, and you want to don't ever want to wash over a clean area, so you start with the farthest area, and then that will be clean, and then you move to the area closest to you and wash that, and then that will be clean as well. So a towel gets placed underneath the patient's arm, and holding the patient's arm at the joint, you can wash the forearm, the upper arm, including the armpit. And you notice that she's made her mitt there. Then covering it up to provide privacy and keeping her warm, rinse out that washcloth from the soap that has been applied, and rinse the arm thoroughly. Lots of times patients have excessive use of soap, and as a result it promotes a lot of skin dryness. So limit the amount of soap that's used, particularly in elderly people. Dry the arm well. You notice how well she's drying the arm and underarm as well. Afterward, lotion can be applied to the arm. In addition to lotion, sometimes patients will have deodorant, or your facility will have a deodorant, or a powder that could be used if the patient would like. Next, you're going to want to wash the hand, and the hand gets washed separately. And sometimes the hand can fit directly into the basin and make certain that it's over the basin. This is particularly good for people who are arthritic, and it helps relieve some of the achiness of those joints in the fingers and hand. It also softens up the nails, and if you're going to be doing nail care, which you would do at this time, it will allow the dirt from under the nail to be softened. And if you're going to be using a clipper and clipping the nails, then it makes the nail tissue itself a little bit softer to work with. Just a little bit about clipping nails. There are some restrictions for clipping patients' nails. So be certain to check with your facility whether or not on this particular patient this is something that you should be doing or not. There are instances sometimes the patient may be on blood thinning medication, or it could be that they're diabetic. Sometimes in with those people, the nails are not to be clipped by a nursing assistant. Now that the far arm and hand have been washed, rinsed, and dried, now the towel is moved to the opposite side, the near side of our caregiver, placed underneath the arm, and folded up around the patient's arm while the caregiver gets, again, washcloth, places into the mitt fashion, and then washes after she applies a little bit of soap to that. During the entire time that a bath is being given, it's important to have the patient's assistance as much as possible. Independence is something that we want to foster with patients. Also, range of motion is something that we want to encourage. And so whenever the limbs are moved, be thinking about the range of motion activity that will keep those joints limber and functioning properly. You also want to carry on a conversation with your patient as you're bathing them. You can find out lots of important information from patients as you're giving their bath, and it's important to focus on the patient and a conversation about them, how they're feeling, their family situation, fears that they might be having, as opposed to focusing in on you. And certainly if there's any significant things that you feel that the patient is stating, if they haven't slept well the night before, if they're having pain, be sure that you get that information reported to the nurse as soon as possible when your bath has been completed. Now the patient's arm and hand have been washed, they've been rinsed and in the process of drying and tucked back underneath the bath blanket. The next thing to be done is the chest gets washed, and you notice how the caregiver is placing the bath towel over the bath blanket, and then the bath blanket gets lowered to the waist level. This will provide for privacy again, and even though this can be a little bit uncomfortable for the patient to have a caregiver washing their chest area, particularly females, the breast area, as you make it matter of fact and help the patient feel comfortable with it, they will become more at ease as well. You notice that she's providing privacy, but at the same time she's observing the chest area. And you would want to be noting any rashes the patient might have, any discoloration. Sometimes breast tissue, when it's raised, has a reddened area underneath it. That's not normal, and it needs to be reported to the nurse at once. There can also be some lumps that might be felt. Anything that is abnormal, you would certainly want to make note of. Then the chest area gets rinsed and dried off, and patting is better than rubbing too vigorously and making it uncomfortable for the person. After the chest area, then the abdomen has also been washed as a part of this procedure. The caregiver followed that with the lower part of the below the breast area and down to the above the pubic line. The side rail now needs to be put back up and fresh water obtained. Lots of soap and in the water and the soiling from the patient's skin require you to change the water frequently. Exactly how frequently to change the water is rather individual, but it could be more often than we are demonstrating here today. But certainly you would want to not change the water any less frequently than we're showing. Again, the water is about 105 degrees. The side rail then can remain up on the upper portion of the bed because the attention is now being turned to washing the legs. The legs get washed in much the same fashion as the arms did. By that I mean the far leg, or the more distal leg, gets washed first. And again, it's for the reason you're not going to want to be washing over a clean area. And the towel gets placed underneath the leg and wrapped around the individual for privacy and warmth while the mitt is being made. Now the leg gets washed, and you notice the caregiver flexes the leg. Sometimes patients can help with that, but if they can't, it's a good idea to plant as much as possible the heel of the person's foot so that it makes it easier for you to be able to support the leg and wash it at the same time. If there's going to be dryness of skin, lots of times it's the legs that tend to be drier than any other portion of the body. Again, while you're washing every part of the body, you want to do some range of motion as well as observing the entire time that you're working on a part and continuing to converse. You notice how she's patting the leg as opposed to rubbing or massaging it. That can cause some harm for people that are bedridden, so important to just pat the leg dry or any body part. Now the foot itself is going to be placed in the water, and generally people really like to have that. It feels awfully good. The mannequin we're using isn't as cooperative as a real patient's leg and foot, but the heel and leg goes in, or the foot goes in, and you have to be careful so that you don't end up with water everywhere. Also, really important to wash carefully between every single toe. Lots of times there can be cracks in the toes, there can be debris between the toes, and washing separately between each toe is important. Also, you're going to be observing for any redness. Sometimes if there's redness, it would be on the bony prominence, particularly of the heel, or sometimes on the toes, but observe for things as you're washing. Another thing, patients may be ticklish when washing the feet, especially, and have very little tolerance for that. One of the best ways to prevent that ticklishness from occurring is to have firm movements and making certain that the person is feeling clearly what you're doing, and sometimes diversion can also be of assistance by talking to them, and frequently then they aren't as aware of the ticklishness as you're doing it. Now that the far leg has been washed, rinsed, and dried, and a lotion applied, then the caregiver moves to the near side and does the exact same thing. I might note at this point there are times that lotion, rather than being put directly on the leg, some people will suggest putting lotion directly into the water. There are other products that can be placed in the water itself to add some moisture, but you'll have to check with your facility what products are available and check with the nurse specifically of what could be used in this instance. But applying lotion in the water itself, if that were the case, then you would not be rinsing it off at the end of it. You'd want it to leave and then just pat the leg dry as you did on the other leg itself. The very last portion now to be done on this patient while they're lying on their back is this last foot. And then after this has been completed, it's going to be time to change the water. And you would never ever want to do the back care after you had been washing the patient's foot in that same water. And the same goes for the washcloth. You would want to be certain that when you start the back, you're going to be starting with a fresh washcloth as well. And so all the washcloth, as well as the towel, because the towel that you've been using to dry the limbs, the chest and the abdomen, will have become quite damp at this point. And so those items will be disposed of in the laundry hamper. And the last thing to be done, if there are side rails on the bed, you would, on the lower portion of it, of course you would put it up. This particular bed doesn't have it. But then fresh water is obtained, and after the fresh water has been obtained, then it's going to be time to turn the patient and begin the back procedure. Now fresh water has been obtained, as well as a fresh bath towel and fresh washcloths. The mitt is made again. The side rail has been lowered, and the person has been turned on their side. You notice that a towel has been placed underneath the length of the patient's body, and it's now time to wash the person's back. Notice how carefully the caregiver is to only expose the back. The buttock area has remained covered by the bath blanket, and only that portion of the back that's being washed needs to be exposed. Now she's rinsing it and noting for any rashes. Particularly note any redness on any of those bony portions of the scapula. Pat the area dry at the completion of the washing and rinsing, and then it's time for the back rub. Back rubs are given with every bath, and its lotion is always warmed in the hand. In addition, sometimes the entire lotion bottle will be placed into the basin itself to be warmed. And after it's warmed in the hands are applied to the low back and work in symmetry, going up the back and around the shoulders and down and back up again around the shoulders, and providing firm, smooth strokes. This should not be a choppy experience. It should be really relaxing for the patient. Most of the times when done well, the patients very much enjoy a back rub as part of their bath. It is not something that you should be asking the patient, would you like a back rub? It should be assumed that a back rub would be given with every bed bath that's done, and this is certainly because the patient is spending an awful lot of time in bed, and those muscles and bones will get very achy. Sometimes patients feel that because you are so busy, no, it's okay, it's not necessary to give a back rub, so don't give them the option, just go ahead and do it. A back rub should last approximately 1.5 to 3 minutes. And you wouldn't want to just give a back rub for 30 seconds. It's not a very relaxing procedure when it's only done for such a limited amount of time. This is another reason why it's so important to have short nails. To be giving a person a back rub can easily scratch a person if the nails are long. So having short nails for this part of the bath is particularly important. Now, if there's any excess lotion on the back after the back rub has been given, just blot it dry with the towel that you're using for drying. Now it's time to do the buttock, and of course, in order to do that, gloves need to be applied. I should make notice that you have not seen gloves being used prior to this time with this bath, but it would be something that you might want to consider doing, certainly if there's any drainage from wounds that you might have noticed, or if the patient has stool or urine that is on them in other parts of the body, then you would want to apply your gloves earlier in the bath procedure. But certainly, if you hadn't prior to this time, you would want to be applying gloves now at this time. The first part of the buttock that gets washed is generally the cheeks of the buttock. And you notice that she's only exposing the buttocks itself and making certain that privacy is maintained during this whole procedure. After the cheeks of the buttocks are washed, then the patient can be washed between the cheeks of the buttock and wiping from clean to dirty up the crack of the buttock, and then cover it up again with the bath blanket while the washcloth gets rinsed off thoroughly in the basin. And after the mitt is made again, the rinsing begins in the same fashion as the washing was done. This is again a time that distraction by talking to the patient can help relieve some of the uncomfortableness of from the patient's point of view by having someone else washing their buttock area for them. Now that this has been completed, the bath blanket gets put back on, the gloves can be removed, and the side rail gets put up, and now it's time to change the water again. Fresh water has been obtained, and the gloves has been reapplied because the last portion of the bath is going to be to wash the perineal area. The perineal area on the female is considered to be the labia and vulva. And again, you only expose that portion that is necessary. Notice as we're zooming in a little bit more closely, the caregiver has washed on the far side, and then she's washing at a different portion of her washcloth on the right side, or the near side. And now the last or third wipe is down the center, called the vulval area. And she's only going from top to bottom or from front to back. You never then go from back to front. Let's see it in slow motion this time as she rinses. The far side from top to bottom on the labia on the far side. Then she uses a separate portion of her washcloth and wipes from top to bottom on the right side, or closer side to her. Then another portion of the washcloth, and she separates the labia and washes right down the center of it. A little bit difficult to see on the video, but you can tell as I've described it as well. Then it's patted dry, and we're going to cut away now and cover the person up, and then I'm going to show a demonstration of how you would do this if this were a male patient. As with washing the perineal area of the female, for the male peri area, you're going to put the gloves on, have your fresh water, and make your mitt. And then you're going to gently raise the shaft of the penis with one hand. And if the patient is circumcised, retract the foreskin carefully to expose what's called the glans penis. Using circular motion then, cleanse from the tip of the penis outward and wash downward towards the shaft with soap and water. And you notice she's using different portions of the washcloth as she does that. Then cover the genital area up while the water is rinsed, and then again, you repeating those same steps, circular motion starting from the tip of the penis and washing down the shaft of the penis at the end. Inspection during that whole time is very important to make sure that there are no abnormalities that might be observed. After the penis has been washed, then the foreskin gets returned back to its original normal position after it has been retracted. Then after the penis itself has been washed, the scrotal area gets washed secondly. And lift the scrotal area, wash thoroughly, followed by rinsing, and then patting the area dry. You may be able to notice that there is a underpad in this bed. Maybe it isn't as clear to you, but it's a good idea because it will help prevent any moisture from getting onto the linens themselves. This is the completion of the bath. Following that, of course, the patient would then have their gown, fresh gown applied after you remove the gloves, and then the person probably would be having their bed changed as well. But the demonstration of changing the bed will be covered on a separate tape. So we leave you with the application of a fresh gown on this person. Then, of course, then you would also have the ending procedure of lowering the bed, opening up your curtains, and making certain that the patient is comfortable after disposal of all of your linens, and always at the very completion of procedures, washing your hands as well. Now that you have seen a demonstration of a complete bed bath, there are several things in closing that I would just like to add. First of all, before giving a complete bed bath, be certain that you offer the patient the bedpan. It can be very uncomfortable for a person who has elimination needs to go through a complete bed bath without an opportunity to do so. And if the patient does need to have you stop the complete bed bath and utilize the bedpan, your water is going to be cooling off, necessitating you getting fresh water. And so it's just a better idea that you offer the bedpan prior to starting the complete bed bath. The second thing is that you need to get in the habit of always checking the water temperature, which, as you remember, is to be between 105 and 110 degrees. Always check it with a water thermometer. Because of the aging process and because of possible paralysis that the patient might have or the patient's confusion, they're not able to sense if the water temperature is too hot. And they could become burned if you were just relying on your hand to get the water temperature correct. So take the guesswork out of it and always use a water thermometer. Also, you can have the patient too cold as well if you don't use the water temperature. A temperature of 95 degrees is really very uncomfortable for the patient, and so checking it with a water thermometer is extremely important. Also, watch out for drafts and chilling of the patient. Because you're busy doing the complete bed bath, you probably are going to be perfectly comfortable in the patient room. But you might notice by what the patient is saying or by their behavior, such as being chilled, seeing goosebumps, things like that, that the patient is uncomfortably cold. So if you see that happen, be certain to address that by providing additional bath blankets, warming up your water, raising the temperature in the room, or whatever is necessary to make the patient more comfortable. I hope you found this tape useful and helpful to you in demonstration of how to give a complete bed bath, and trust that you will always continue to utilize this bath procedure when giving a complete bed bath.